Hi guys, welcome to my channel. We talk about kidney anatomy. Introduction of the kidney anatomy. The kidneys are the pear-shaped organ located either side of vertebral column. They are main organs of urinary system and they are responsible for filtering blood. Function of the kidney. Function number 1, they filter blood and remove waste product. They regulate water and electrolyte balance. They produce erythropoietin to stimulate red blood cells production. They maintain acid and base balance. They regulate blood pressure by secreting urine. So we talk about the location. They are retroperitoneal organs. They are behind the peritoneum. So remember that they are behind the peritoneum. So right kidney locate L1 to L3 and left kidney is the locate T2 alif to the L3 vertebral column. Right kidney is lower than left kidney due to the liver. So we talk about this size and shape. Shape is a bean shape. Length is 11. So width is a 6 centimeter. Thickness is a 3 centimeter. Weight male is 150 to 170 gram. Weight female is the 120 to the 150 gram. So we talk about external feature. Each kidney has superior border, inferior border. Superior ball, inferior ball, lateral border, and its convex and medial border is a concave. An anterior surface and posterior surface and renal hilum. So we talk about renal hilum, and renal hilum is this. At the content is renal vein, renal artery, and renal pelvis. So mostly superior and anterior one is the renal vein, and after that renal artery, after that renal pelvis, and this a mnemonic VAP. Don't forget that. Just memorize VAP. So we talk about covering the kidney from inside to outward. The first is the fibrous capsule or renal capsule, and then perirenal fat or perinephric fat, and renal fascia and pararenal fat. And the function of this covering is the protection, supporting, shock absorption, anchoring the kidneys in position. So we talk about internal anatomy. So this is renal cortex, renal medulla, renal pyramid, papilla, renal papilla, main calyx, minor calyx, major calyx, and renal pelvis and ureter. So we talk about nephron. Nephron is the structural and functional unit of the kidney. You see in the pyramid. So nephron is, we have 1 million nephron in our each kidney, more than 1 million. Yeah. So we have glomerulus, Bowman's capsule, proximal conflictable, lobe of Henle, distal conflictable, and collecting duct. After collecting duct, you have minor calyx, major calyx, and renal pelvis. Remember that. So we talk about blood supply of the kidney. The blood supply of the kidney is the renal artery from the abdominal aorta, and vein is the renal vein. So you need to memorize this chart for the exam because of its importance. So renal artery, screenshot it. Renal arteries, mental arteries, interlobar artery, after arcuate artery, cortical radiate artery, efferent artery, glomerulus, efferent arteriole, peritubular capillary, venous, cortical radiate veins, arcuate veins, interlobal veins, and renal veins. After that, we talk about nerve supply. Kidney receive autonomic innervation from the renal plexus. It's important. Sympathetic T10 to the L1 spinal segment. Parasympathetic is the vagus nerve, cranial nerve 10. Lymphatic drainage or lymph drainage drain into the lumbar lymph or para-aortic lymph. So we talk about relation of the kidney. So right kidney anterior is the liver, second part of duodenum, hepatic flexure of the colon, and small intestine. Right kidney posterior is the diaphragm, two alif rib, psoas major, quadratus lumborum, transverse abdominis. Left kidney anterior, stomach, spleen, pancreas, jejunum, splenic flexure of the colon. Left kidney posterior, diaphragm, 11 and 2 alif ribs, psoas major, quadratus lumborum, and transverse abdominis. I remember that we have quadratus lumborum and transverse abdominis, left kidney posterior and right kidney posterior. So after that, we talk about clinical correlation. The clinical correlation of the kidney is the kidney stones, hydronephrosis, polycystic kidney disease, renal artery stenosis, acute kidney injury, and chronic kidney disease. If you need to know more about this, you find it another video.